Thank you, Mr Speaker. My question is for the Minister for Health. Minister, Ballina Hospital has been evacuated twice in the last 3 years due to extreme weather events. What are you doing to future-proof that hospital for my community?
I call the Minister.
Thank you, Mr Speaker, and a good question from the member for Ballina. Someone I think the Chamber would agree advocates and lobbies and argues for her community in a very strong way. And like those on the North Coast, members have had a really tough few years and some big challenges. One of the things that we are looking at and in the process of doing is a clinical services plan. Many of you will know what they are. They are essentially the blueprint as to what that hospital and what the services that hospital will provide in the future, Mr Speaker. We're doing that for a range of different reasons. One, because it's due to occur, but two, the demographics have changed across Ballina and the North Coast, and three, the issues that flooding has highlighted for that community. So we're doing that piece of work. Over the last two budgets, we've allocated around about $3 million to go into planning and feasibility work for a future upgrade to that hospital. And I know that the member has been a strong advocate, and I know that representatives from local government have joined her in that advocacy as well as community members and staff. So I'm very much aware of that. We've got it to a stage where that feasibility allocation has been spent. In addition to that, we have also allocated around about $3 million over the last little while in terms of upgrading or maintenance, repairs and enhancements to that hospital, and I think around about $250,000 has been allocated recently in the last year for small capital improvements. So we are investing in that hospital. We're not in a position yet to announce what the next stage of a redeveloped hospital will be. That will be informed by our consultation and discussions that will be guided by the clinical services plan. It is important for members to note, and this has been in place well before this government, and I'm acknowledging the former government and governments before that, that in New South Wales, unlike other jurisdictions around the country, why our health system is so strong is because we operate a networked model, which means that we allocate people to the best and most appropriate hospital within that network. That is not the way other jurisdictions always work. Many jurisdictions work one out and isolated hospitals. We don't believe that is clinically best practice, and that is why we work through a network model, including on the North Coast. I do want to emphasise a couple of things that I know the member has been a strong advocate for.
Yes. Member for Ballina, yes. Additional 2 minutes is granted.
I know the member has been a strong advocate for, and I think her own party advocated for ratios and the rollout of ratios. We are the first government to implement that reform in New South Wales. We're up to around about 570 additional nurses already. Around 9 nurses are going into Ballina Hospital as part of our emergency department ratios reform. That is a significant boost to that hospital, and I want to thank the member for Ballina for her personal advocacy on behalf of that community, because ratios in our emergency departments make a difference. They improve timely access to care, they improve patient safety, and they improve retention and recruitment of nurses. All of those things are important to deliver enhanced healthcare. In addition to that, the member also advocated in our first budget for the government to secure the employment of 1,112 nurses. For her local health district, that's the equivalent of around about 51 nurses for her local health district. 51 nurses that wouldn't be in place without guaranteeing that reform, and that has been an important investment on top of what we're doing in ratios. I understand the member is advocating strongly for her community. We will work through that in the lead up to the next budget. She has been very strong and very consistent in making sure that Ballina Hospital gets the resources it needs. We'll be informed by the clinical services plan, and I'll continue to engage with the member for Ballina and through her with her community, as well as staff on the ground, around the work that this important hospital does to deliver vital health services for the people of the North Coast.
Speaker,
Member for Parramatta.
my question is